And so the next question is a bit of a hard pivot. This is for Dr. Cooper. And so we've spent a lot, I think, at these GRACE forums, at various forums in the lung cancer community talking about biomarker testing. I loved how much attention you gave to identifying these ADC targets, but I think it's important for us to kind of contextualize. So does our traditional biomarker testing, here I'm talking about next generation sequencing of tissue or liquid biopsies, so plasma, does it give us insights into how these ADCs might work? And is it for a subset? Is it for everyone where this might be informative?
Yeah, thanks for the question. It's such an interesting and really evolving space, actually. So, of note, only in the past couple of weeks has there been a change in sort of the indication for even those more general ADCs. For example, datopotamab deruxtecan was originally intended to be a drug for sort of all non-small cell lung cancer patients treated in the later line. But actually, the company just withdrew that application within the last couple of weeks and instead is pivoting and focusing on applying that agent just to patients with EGFR mutations. And so, it's a challenging question without a clear answer because I think honestly, the development is still sort of ongoing and the science is still sort of being performed as a sort of like, to help us sort of understand where we are. I think there is some rationale to try to apply some of these ADCs to some sort of genomic subsets, like traditionally, like we think of that are found on NGS. So, like EGFR mutations, HER2 mutations, as I talked about with trastuzumab deruxtecan. But, in terms of the other agents, TROP2 is not something that's found on a genetic test, and indeed is actually not even predictive of response. So I think we're in a little bit of a C here because as I tried to convey, trastuzumab deruxtecan was super exciting and sort of made us think that we were going to be on the right track with like HER2 mutation, HER2 targeting drug that worked really well. Like that's a partnership that's going to move forward and we can be able to capitalize on that and sort of recapitulate that for multiple targetable alterations in drugs. And we just have not totally been able to get there yet. So it's a long-winded answer to say we're not quite sure actually how it's all going to pan out overall.
Don't ever apologize for a long-winded answer. We gave you guys massive topics to discuss in 20 minutes each. And so there was a lot of, I think, foreshadowing kind of future talks and future development in this area.